Hello, everyone. This is your loving host, best selling author, radio, and TV personality, Dr. Afshan Hashmi, live from a studio in Rockville, Maryland, USA. And tomorrow I am going to discuss the outbreak of hepatitis 2. Acute hepatitis of unknown cause in United States of America. And I wanted to just remind you that these are my two books, The Modern Mughal Mentality, New Strategies to Succeed in India, and The Global Marketplace. When this book came in 2015, there was no trace of coronavirus, and there was lot of research going on in Harvard and Stanford for Jugaad, the Indian buzzword. And friends, this book was hot number one new release on Amazon, as well as it was Amazon bestseller. So please go and buy this book and give me an honest review. Through the sale of these two books, I give little bit to charity to help under privileged people, as well as I finance these kind of programs. And this one is the outbreak of a monstrous infection. This book talks about when this book came in 2019. At 1st February 2019, there was no trace of coronavirus. And friends, at coronavirus started from December 2019, and how I predicted that there will be bioterrorism, and this book supports that. I am writing the screenplay, so all those Hollywood, Bollywood agents, whoever makes movies and web series and all, you can contact me at Afshan at drafshanhashmi.com and just see what is going on, like in America now. We were suffering with coronavirus, and now there is an outbreak of hepatitis. So we will listen together the CDC's deputy director's telebriefing, and I will play it, and then we will talk about it. And it is 45 minutes long, so it is quite long. So just hang in and listen to that. If you have many children are suffering through that, and this topic, it has touched my heart and has always touched my heart, that why bioterrorism is spreading. For the second book, in a very unique story, I have taught about bioterrorism, and this was an Amazon bestseller, and I am looking for a movie to be made or a web series. And I will be from now writing books on bioterrorism, and I am writing my third book, and I want to make it a franchise of movies. So all those Hollywood, Bollywood producers listening, you can contact me at Afshan at drafshanhashmi.com, and let's listen to what the CDC deputy director has to say.
Welcome, and thank you for standing by. All lines have been placed in a listen-only mode for today's presentation until the question and answer session. If at that time you would like to ask your question, please press star 1 on your telephone keypad. The call is being recorded. If you have any objections, you may disconnect at this time. I will now introduce your conference host, Mr. Ben Haynes. Sir, you may begin.
Thank you, Catherine, and thank you all for joining us today. We're joined by Dr. Jay Butler, CDC's Deputy Director for Infectious Diseases, who will provide a brief update about CDC's investigation into children with acute hepatitis and adenovirus infection before taking your questions. During the question and answer period, Dr. Butler will be joined by Dr. Umesh Parashar from CDC's Division of Viral Diseases. I will now turn the call over to Dr. Butler.
Hey, thanks, Ben. Good afternoon, everyone. Good morning to those of you in the West. Thank you for joining us today for an update on the investigation of hepatitis of unknown cause impacting children. 15 days ago, CDC issued a nationwide health alert to notify clinicians and public health authorities about an investigation involving 9 children in Alabama identified between October of 2021 and February of 2022 with hepatitis, or inflammation of the liver, and adenovirus infection. All of these patients were previously healthy, came from different parts of the state, and were hospitalized with significant liver injury without a known cause, including some with acute liver failure. All 9 ultimately tested positive for adenovirus, which is a common virus that typically causes mild cold or flu-like symptoms or stomach and intestinal problems. Since issuing that alert, which called for the notification of possible cases extending back to October 1st of 2021, we've received a number of reports of similar illnesses from healthcare providers and state health departments across the country, and we've been working diligently to evaluate these reports. The purpose of today's discussion is to give you an update on what we're learning. As of today, CDC is investigating 109 children with hepatitis of unknown cause occurring in 25 states and territories over the past 7 months. Sadly, this does include 5 reported deaths. Overall, more than 90% of these patients under investigation were hospitalized. 14% received liver transplants, and more than half had a confirmed adenovirus infection. It's important to note that this is an evolving situation, and we're casting a wide net to help broaden our understanding. This includes a retrospective review of these reports going back to October of 2021. As a result, today's update must be put into context for a more accurate picture. Although rare, children can have serious hepatitis, and it's not uncommon for the cause to be unknown. The 109 patients under investigation were identified as having been ill within the past 7 months, so not all are recent, and some may ultimately wind up not being linked to the current investigation. And based on a preliminary analysis of limited data, there has not been a significant increase in pediatric hepatitis cases or liver transplants, including from before the COVID-19 pandemic. While many questions remain, we wanted to share the latest information, including what we're doing to monitor and learn more about this situation, as well as the questions that we're asking as we approach this investigation. So here's what we now know. Among the patients originally identified in Alabama, lab tests identified that some had adenovirus type 41, which more commonly causes severe stomach illness. However, none of these children had significant underlying conditions, which is more commonly seen in adenovirus type 41, which occurs in immunocompromised patients, and is not usually known as a cause of hepatitis in otherwise healthy children. CDC is also aware of pediatric hepatitis cases of unknown cause recently reported in other countries, and we are working closely with public health officials around the world to understand what they are learning. Based on initial investigations both here and abroad, some of the common causes of viral hepatitis, such as hepatitis A, B, C, Delta, and E, have been considered and tested, but not found in any of these cases. In addition, none of the 9 children in Alabama had COVID-19 infection during their hospitalization or a documented history of COVID-19. Additionally, we know that none of the children in Alabama had received the COVID-19 vaccine prior to being hospitalized for hepatitis. The children affected are young, with a median age of 2 years, which means that most are not eligible to receive the COVID-19 vaccine. COVID-19 vaccination is not the cause of these illnesses, and we hope that this information helps clarify some of the speculation circulating online. Here's what we don't know yet. Investigators both here and abroad and around the globe are working hard to determine the cause. Adenovirus has been detected in some of the children, but we don't know if it is the actual cause cause of these illnesses. Among 109 patients currently under investigation, more than half have evidence of an adenovirus infection. In addition, adenovirus has been detected in many, but not all, of the cases occurring outside of the United States. We also don't know yet what role other factors may play, such as environmental exposures, medications, or other infections that the children might have. CDC is working closely with clinicians and public health departments nationwide, as well as with our international counterparts, to rule out possible causes and identify other possible contributing factors. We're actively engaging with public health partner organizations to share information and make sure we're prepared to diagnose and treat additional cases. We're gathering more detailed data on these patients under investigation, but I want to caution that it may take time to assess the evidence and to learn more. We're also examining national data sources to look at pediatric hepatitis trends, as well as possible patterns in adenovirus infection over the past several years, even prior to the COVID-19 pandemic. Following input and collaboration with laboratories around the country, CDC is issuing new guidance for clinicians related to adenovirus testing and reporting of possible cases of pediatric hepatitis of unknown cause. Most important for patient care, CDC urges clinicians to continue to perform their standard diagnostic workup for children with acute hepatitis. Because we're still investigating the possible link between adenovirus infection and hepatitis, we are also recommending that clinicians evaluate these patients and consider testing for adenovirus. We know this update may be of concern, especially to parents and guardians of young children. It's important to remember that severe hepatitis in children is rare, even with the potential increase in cases that we're reporting today. While this investigation is ongoing, we encourage parents and caregivers to be aware of the symptoms of hepatitis. These can include vomiting, dark urine, light-colored stools, and yellowing of the skin, also known as jaundice, and to contact their child's healthcare provider with any concerns. We continue to recommend children be up to date on all their vaccinations, and that parents and caregivers of young children take the same everyday actions that we recommend for preventing a number of infections, including washing hands often, avoiding people who are sick, covering coughs and sneezes, and avoiding touching the eyes, nose, or mouth. As we learn more, we'll share additional information and updates. I'm sure you have questions. I look forward to talking with you further, and with that, I'll turn it back over to you, Ben.
Thank you, Dr. Butler. Catherine, we're ready to take questions.
We will now begin our formal question and answer session. If you would like to ask your question, please unmute your phone, press star 1 on your telephone keypad. Only record your first and last name. To withdraw your question, you may press star 2. Once again, to ask your question, please press star 1 on your telephone keypad. And 1 moment for the first question. The first question is coming from Erica Edwards of NBC News. Your line is open.
Hey, thank you so much. I know you said that most of these kids were too young to have the COVID vaccine, but I'm wondering if there any investigation into whether a prior COVID infection may have played some kind of role, maybe causing the immune system to have an abnormal response to an adenovirus. And then further, I'm wondering if the CDC is looking into any greater monitoring of adenovirus spread in the U.S. Thank you.
Great. Thank you for those questions, Erica. Regarding the role of COVID-19, we are not aware of cases that are occurring in kids that have documented COVID-19. That certainly is true among that initial 9 cases in Alabama. But it's a question that I think is still unanswered, and we are working to be able to assess whether or not some of the kids have serologic evidence of past infection that may not have been clinically apparent. Regarding the assessment of adenovirus infections, that's also ongoing work. As you're probably aware, our pathogen-specific surveillance for viruses tends to be passive, and so we're looking at ways that we can improve our surveillance to be able to track adenovirus activity in the United States. Looking at the data that we have that is based on passive surveillance, we have not seen an uptick in the number of adenovirus infections, although we also recognize that there may be somewhat of a lag in reporting.
Next question, please.
The next question is coming from Helen Branswell of STAT. Your line is open.
Thank you very much for taking my question. I'd sneak in two if I could. One, the UK Health Security Agency issued a technical brief this morning in which they said they've been trying to do whole genome sequencing on multiple samples, but the viral load has been too low and they haven't been able to get a good quality virus to sequence. Has the US managed to do this? And the other question is, the U.S. is actually the first country that saw cases. Alabama saw these cases in mid-October, and CDC was involved in their investigation, and yet it took till April 21st, which was like 2 weeks after the UK alerted the world to what was going on, before the U.S. or the CDC issued a HON. Why so slow?
Yeah, so the first part of your question about whole genome sequencing, our experience is somewhat similar. Our sequencing data is partial sequencing; it's not complete. And you're touching on something that I think is an important technical limitation in the investigation. Is that the viral load in these children, by the time they're diagnosed, tends to be fairly low. In terms of when the alert went out relative to the first call from clinicians in Alabama, we get a number of calls from clinicians. It sometimes is very difficult when that call first comes in to know whether or not it's a one-off or is it the beginning of something bigger. When we had been contacted by our colleagues in the United Kingdom regarding the more significant uptick in cases that they had seen, that was an easy connection to make and certainly raised concerns. At that time, the cases in Alabama appeared to be more past tense, with no new cases identified in the past 2 months. With the occurrence of what was going on in Europe, that was something we took as a red flag that we needed to look more broadly in the United States, even if there wasn't evidence of ongoing activity in Alabama, and that's what led ultimately to the decision to issue the HON, and also prior to the issuing of the health alert notice, contacting some of our colleagues at the state and local level.
Next question, please.
Next question is coming from Hillary Brick of The Insider. Your line is open.
Hi, thanks for taking my question. I actually just had one simple technical question, which is you mentioned 25 states, or 25 states and territories, so I was wondering if you could give us a list of those and specific steps in. And then my second question is, there's been some speculation in the UK that a lot of these kids had exposure to dogs. Is that something you're looking at in terms of environmental factors? Can you talk a little bit more about what you're exploring? Thanks.
Yes, thanks. So let's start with the states where persons under investigation have been reported. So I will walk through that list of 25. So in alphabetical order: Alabama, Arizona, California, Colorado, Delaware, Florida, Georgia, Idaho, Illinois, Indiana, Louisiana, Michigan, Minnesota, Missouri, North Carolina, North Dakota, Nebraska, New York, Ohio, Pennsylvania, Puerto Rico, Tennessee, Texas, Washington, and Wisconsin. Now, regarding the question about where the deaths occur, I actually don't have that, but also because it's such a small number, we would have concerns about patient confidentiality issues in disclosing that information. Regarding your question about the environmental exposures, investigation of the persons under investigation in the U.S. does include questions about animal exposure as well. We really are casting a broad net and keeping an open mind in terms of whether the adenovirus data may reflect an innocent bystander, or whether there may be cofactors that are making the adenovirus infections manifest in a way that's not been commonly seen before. And even though it certainly is challenging because it's still a very rare occurrence as we look across the country over the past 7 months.
Next question.
Great.
The next question is coming from Spencer Kimball, CNBC. Your line is open.
Hi, thank you for doing the call. Can you talk more about the condition of the children you're investigating? So 90% were hospitalized, 14% had liver transplants. For the kids who didn't get liver transplants, what was their condition like? And additionally, can you just talk about what adenovirus transmission looks like right now in the U.S.? Thank you.
Okay, great. I think let me start answering that question, and then I'd like to call on my colleague, Dr. Umesh Parashar, who may have additional insights into specific clinical conditions. In general, the majority of these kids have recovered and recovered fully. Regarding the condition leading to transplant, the indication would be liver failure. That's not a minor procedure by any means. So maybe in terms of providing more detail, I'll turn it over to Dr. Parashar.
Yeah, thank you, Dr. Butler. I think as you summarized initially, we have the persons under investigation from the U.S. have happened over the past 7 months. So the majority of them have since fully recovered, being discharged from the hospital. There are some recent patients who are still hospitalized, and we are going to continue to collect additional information and update on those data. In terms of the question regarding adenovirus 41, again, as Dr. Butler mentioned, it is not a reportable disease in the U.S. It is also not a pathogen that clinicians would typically test for, and there is no specific treatment if you diagnose it. So our surveillance really relies on passive reporting. And again, we don't have very good national systems for adenovirus 41 type in particular in place, but we are working to get data from certain clinical laboratories that may have this information. So there will be more updates to come on that. Thank you.
The next question, please.
The next question is coming from Brenda Goodman of CNN. Your line is open.
Hi, can you hear me? Hello?
Yes, we can. Go ahead.
Great. The UK Health Security Agency also updated its investigation today with a technical report, and the type of adenovirus they found associated with some of their cases is 41F. And I just wanted to make sure, are we talking about the same adenovirus there? Is 41 the same as 41F? And then also, excuse me, I wanted to ask about the role of SARS-CoV-2 and COVID infections. The UK has left those as a potential cofactor or a confounding cause in some of their cases. And I know you say that COVID is not a cause of these infections. So I'm wondering if you are still considering it as
a potential co-founder or cause, or maybe some of, part of a disease process from kids who have recovered from COVID, like Miss C is, something like that?
Yeah, thank you for the chance to clarify. So let me take your second question first. I want to be very clear, because the vast majority of these kids are not even eligible for COVID vaccine. What I said was COVID vaccination appears to be unrelated to these cases. The issue of whether or not COVID infection may be related to these cases is still under investigation, and certainly a hypothesis that we continue to pursue. Regarding your question about the technical report and serotype 41F, yes, the ones that have been identified in the United States are also 41F. It's just a subtype of the larger group, adenovirus 41. Adenovirus 40 and 41 are the ones that we normally think of as primarily impacting the GI tract. All the other human adenoviruses primarily cause respiratory symptoms.
Next question, please.
The next question is coming from Gina Colada of the New York Times. Your line is open.
Thank you. I have two questions. I know you said you don't really normally do surveillance of adenoviruses, but have you done anything where you would say, if you just take a random child in that age group, what's the chance that they would test positive for an adenovirus? And then I also was wondering, because you said that liver failure or liver hepatitis does occur rarely in children, whether you could tell us how many cases would you normally expect to find, so we can sort of see how much of an increase this is above normal.
Thanks for that question. You truly do think like an epidemiologist, which frustrates me then when I feel like I don't have the best answers to questions like that. So starting with the question about hepatitis in children and looking for baseline data, one of the quick things that we can do is use our sentinel surveillance, which is primarily related to emergency department visits across the country. At this point in time, we have not seen an increase above the baseline in the number of visits for pediatric hepatitis. Regarding your question,
so you haven't seen an increase above the baseline for pediatric hepatitis. Then why do you say that these cases are why are you investigating them if you haven't seen an increase, I guess is the question.
Well, I think the issue that comes up is the relationship to adenovirus, and certainly, as I was about to say, we know that pediatric hepatitis cases don't always have an etiology identified. So I think in many ways your question is raising some of the questions about the hypothesis of what is going on. Are we recognizing something that actually happens many years or at irregular intervals? And for whatever reason, we're seeing it now because perhaps there's been expanded use of adenovirus testing. Is it because of the suspicions of some astute clinicians that this might have been an unusual number that occurred in one locality? These are all hypotheses that we're pursuing. I'm actually going to see if Dr. Parashar might have a better answer regarding the testing of just the pediatric general population where we might find positive adenovirus test results. Dr. Parashar, do you want to take a stab at that?
Can I make sure I understand, though? What you're saying is what makes this unusual is not the number of cases, but the possible association with adenovirus. That's what makes it unusual? I just want to make sure I get this right.
Yeah, no, so I appreciate your pursuing that. I think what we're seeing in the United States right now is not We haven't documented an increase in the number of pediatric hepatitis cases yet. In the UK, it does appear to be that there has been an increase. In the other parts of Europe that have reported cases, the numbers are relatively small. So again, it's an evolving situation, and so at this point in time, we have not documented an overall increase in the number of pediatric hepatitis cases. But let me be very clear, that's not to say that it's not occurring. We are doing what we can to be able to really pursue that question and determine whether or not what we're seeing is maybe more identification of the etiology at baseline, or are we actually seeing some increase in the number of cases?
Okay, thank you.
Thank you. Dr. Parashar, do you want to address the adenovirus diagnosis question?
Yes, sure. Thank you. And again, there's probably not a good, simple answer, and that's partly because it likely varies from year to year and from the time of the year you're in. We know adenoviruses are seasonal, typically in the fall, winter months in the US. And so if you were to sample a random child in the season, the chances of finding them positive would obviously be higher than, say, during the summer months. We also know for many infectious diseases, including enteric viruses during COVID, the levels were very low because of the social distancing measures. And if you had sampled the child last year versus doing it now, the prevalence you would find would be different. And that is one of the possible hypotheses out there. Is this is indeed related to adenovirus 41? Is it because of greater transmission this year compared to even pre-COVID seasons, because of potentially many children not being exposed during the past 2 years, and therefore you have a larger number of susceptible people? So these are all the issues and reasons why we are continuing to examine this carefully, in addition to looking at adenovirus detections in children with hepatitis. We are also going to likely look at the baseline rates in otherwise children who don't have hepatitis, which really would point to an etiologic association. So it is a very good point you raised.
Next question, please.
The next question is coming from Maria Godoy of NPR. Your line is open.
Hi, thank you for taking my question. Just to pursue that line of questioning further, the adenovirus 41 is not known previously to be related to hepatitis, correct?
Hepatitis has been associated with adenovirus 40 and 41, but almost exclusively in immunocompromised children. So one of the things that does seem to be unusual in this instance is that many of the children who are affected, all of them among the 9 in Alabama, did not have immunocompromising conditions.
Is that true for the UK cases as well?
I'm sorry, go ahead. Can you repeat that, please?
Do we know if that's true for the UK cases as well?
In general, that is true, yes.
Next question, please.
And the next question is coming from Assam Hamed of AFP. Your line is open.
Hi, thanks for doing this. I think you've already alluded to several of these, but could you just maybe just sum up some of the main hypotheses that you're working or looking at? You talked about environmental factors, animal exposure in dogs, lack of, the lockdowns and not training, the effect of adenovirus on kids who weren't exposed for a long time. So could you just sort of summarize the sort of main ones the avenues that you're investigating?
Yeah, thank you. So, of course, we don't yet know the cause, but the investigation both here and across the globe is focusing on a wide variety of hypotheses. So because of the link to adenovirus, I would call that top of the list of viruses of interest. But we don't know if it is adenovirus itself that is causing the cases. Is it the immune reaction to this particular strain of adenovirus? Or is there an infectious or environmental cofactor that may be contributing as well? So I think at this point we have those hypotheses. I think we also are seriously considering whether or not, getting back to something I said earlier, whether or not this may be something that has happened at a low level for a number of years and it's more recognizable this year, although we haven't documented yet in the United States an increase, but in the UK they have. Is that because there has been a decrease in the number of infections over the past 3 years due to some of the community mitigation efforts related to COVID-19? In other words, are we seeing now some catch-up infections as the community mitigation efforts for COVID-19 are being lessened?
Thank you. Next question, please.
The next question is coming from Tom Howell, The Washington Times. Your line is open.
Hey, thanks for doing the call. Just real quick, do you have a global number of how many cases? You provided the U.S. numbers. And also, can you just give us some virus 101? How does this adenovirus usually spread prior to this situation? Is it, like a respiratory thing with cough droplets? And is there any reason to think, to explain why this is attacking the liver in particular? Thanks.
Yeah. Thanks for that question. I'm actually going to turn that over to Dr. Parashar, who may have the latest from the WHO on the global situation.
Thank you, Dr. Butler. And yeah, the situation keeps changing a bit because we hear updates from various countries. As you mentioned, there was a new update from the UK today, and they alone have over 160 cases now that they are evaluating. I think globally, I'm not sure with that update what the exact count is, but it is clearly over 200 from countries outside the US. So it's certainly an evolving situation that changes as more reports are updated on each day. And I'm sorry, could you repeat your second question?
I was just wondering how this adenovirus spreads normally in a typical situation, if it's like a respiratory cough droplet type thing, and if there's any explanation of why it might be attacking the liver in particular in this instance.
Yeah, those are great questions. So, yeah, as Dr. Butler said, there are different illnesses caused by different adenovirus types. Most of them cause respiratory illness, so it's cough, colds, and those spread by contact droplets, the way you described. The particular type that has been found in many of these patients are the adenovirus type 41. These are typically viruses that cause gastroenteritis, so they cause vomiting, diarrhea in young children. They're common viruses, so in addition to the other modes of transmission, there's the potential for fecal oral transmission. And the question about what is potentially causing this adenovirus 41 to become to infect the liver in these cases is somewhat of an open question still, because as Dr. Butler said, we truly don't know if it is the cause of illness. So I think we are going to look at it in a very broad way. If it is your typical adenovirus, is there something about the host, such as the immune conditions or lack of exposure previously, or a previous SARS-CoV-2 exposure that affects how adenovirus manifests, or as was mentioned also, if this is a particularly large season because of the mitigations over the past 2 years, and other factors intrinsic to the environmental conditions. Also, potentially, it's possible that there might be some change in the virus itself, and we will only know that after some of this whole genome sequencing studies that were mentioned are completed. So we a template of background strains to see if there's something novel. And as was mentioned, it's also a possibility that adenovirus is not the cause of this outbreak, and we are certainly keeping an open mind to that and looking at drugs, toxins, other environmental exposures, or other pathogens. So I think it's still early days in terms of pinpointing the cause and understanding the mechanism of illness in these children.
Next question, please.
The next question is coming from Marie Rosenthal, Infectious Disease Special Edition, and your line is open.
Oh, thank you for taking my question. Can you use the new wastewater surveillance system to get more immediate information about adenovirus cases? I thought that's what it was kind of set up for.
Yeah, thanks for that question, because we're actually very keenly interested in other potential uses of wastewater surveillance for emerging infectious diseases. At this point in time, we do not have data on adenoviruses from wastewater, and it's certainly a question that we can pursue, but at this point in time, I have nothing to report on adenovirus in wastewater.
Catherine, we have time for 2 more questions.
Certainly, the next question is coming from Krista Moore, Politico. Your line is open.
Oh, thank you. My question was actually about that baseline number of hepatitis cases in kids, so I'm covered. Thank you.
We'll still take 2 more.
The next question is coming from Lucy Hicks, Medscape. Your line is open.
Hi, I was just wondering, I know that the 9 cases in Alabama have been confirmed. I'm wondering if there are any other confirmed cases, or the 109 that you mentioned are all being investigated. Does the 9 Alabama cases are they also included in the 109 total that you mentioned?
Yeah, so thanks for that question. I probably need to clarify in terms of confirmed as opposed to persons under investigation. At this early stage, you may have noted I was very careful to avoid calling these hepatitis cases a case in the epidemiological sense, because we're still refining the case definition. The 9 that are in Alabama are included in the 109, and so at this point in time, I started by saying it's a fairly broad net that's been thrown, so it's basically any kid younger than age 10 that has hepatic transaminase levels above 500. So that's a very general definition of pediatric hepatitis, and those are the cases that we want to do a deeper dive on in terms of etiologic workup as well as collecting epidemiological data.
And our last question, please.
That is coming from James Colby, PhD 11 in Little Rock. Your line is open.
Yeah, thank you for doing the call. My question is about what might be throwing us in terms of finding a smoking gun with adenovirus 41, which is that it's not smoking and it's not a gun. In the NMWR report from the Alabama 9, where the immunohistochemical staining didn't show anything, electron microscopy didn't seem to show any virions or replication organelles. So my question is, if the virus were doing this, why would it not be showing up in the liver? Is there some sort of auto reactivity where a viral antigen looks like a liver antigen, or has that been ruled out? In other words, how could it be doing this but not be in the liver?
Yeah, what a great question. Thank you. So it does raise the question of whether or not it could be a immunopathologic mechanism in reaction to the adenovirus 41 infection. And, one possible supporting piece of evidence is something that we mentioned earlier, as the challenge to the whole genome sequencing is that the viral load by the time of diagnosis is fairly low. That may be a reflection of the fact that there is an immune response that's kicking in that's beginning to limit the amount of virus that's in the body, and may also be potentially damaging the liver. So I think you're highlighting very nicely some of the evidence that's been gathered so far that supports a hypothesis for the pathophysiology of this disease. Thank you.
Thank you, Dr. Butler, and thank you, Dr. Parashar. Thank you all for joining us. If you have further questions, please call the main media line at 404-639-3286, or you can email media@cdc.gov. Thank you.
So, friends, this was the media briefing from CDC, and I would like to thank CDC a lot for briefing us on for what is going on regarding the hepatitis outbreak. While I was listening, that one question came to my mind that what is FDA doing regarding it, and I would love to hear from FDA Commissioner that are our food lines safe. That means that we have fresh foods in all the grocery stores, and what are you doing regarding the contaminated foods, so because all this happens because of contaminated food also, so hepatitis spreads, because of contaminated food. And I am no medical doctor. I am just a PhD doctor in biochemistry, and I have regulatory affairs experience regarding FDA rules and regulations, as well as I am certified CASCP in clinical chemistry. And so these issues are very close to my heart. I wrote a book in which was released on 1st of February 2019, regarding a fictional story, a science fiction story about the spread of a virus, which is bioterrorism. And after seeing the scenario in the world, this topic is very, very close to my heart, and I am going to educate people about bioterrorism, and in a fictional science fiction story, I was debating what to write in my third book. And in my third book also, it will be a fictional story about some chemical spread, so I want to educate people through my author writings, that what harm bioterrorism and chemical attack can do. So friends, having said that, I am very, very thankful to CDC for giving this media briefing, as well as, I have that question which I said earlier with FDA commissioner. And having said that, friends, let me read what hepatitis is. And yes, please go to your primary physician and see everyone that if you are vaccinated or you have full vaccination of hepatitis. Having said that, friends, let me So I got this. I googled like hepatitis in CDC, and I got this viral hepatitis. And it says, what is viral hepatitis? Hepatitis means inflammation of the liver. Hepatitis is often caused by a virus. The most common types of viral hepatitis are hepatitis A, hepatitis B, and hepatitis C. Universal hepatitis B vaccination in adults aged 19 to 59 year. updated recommendations of the Advisory Committee on Immunization Practices 2020. And these are the guidelines and recommendations, and you can go to the CDC website and read about it. It says hepatitis B vaccination screening and linkage to care best practice advice from the American College of Physicians and CDC. Adults recommended to receive hepatitis B vaccine. The Advisory Committee on Immunization Practices ACIP recommends that the following people should receive hepatitis B vaccination: all infants, unvaccinated children aged less than 19 years, adults aged 19 through 59 years, adult aged 60 years and older with risk factors for hepatitis B. The following group may receive hepatitis B vaccination: adults aged 60 years and older without known risk factors for hepatitis B. Risk factors for hepatitis B: persons at risk for infection by sexual exposure, sex partners of persons who test positive for hepatitis B surface antigen, sexually active persons who are not a long term mutually monogamous relationship, for example, persons with more than one sex partner during the previous 6 months, persons seeking evaluation or treatment for a sexually transmitted infection, men who have sex with men, persons at risk for infection by percutaneous or mucosal exposure to blood, persons with current and recent injection use, household contacts of person who test positive for hepatitis HB's antigen, residents and staff of facilities for persons with development disabilities, healthcare and public safe personnel with reasonably anticipated risk for exposure to blood or blood contaminated body fluids, persons on maintenance dialysis, including in center or home hemodialysis and peritoneal dialysis, and persons who are pre dialysis, persons with diabetes at the discretion of the treating clinician. So, this is, and you can Google hepatitis on CDC webpage for more information, because everyone should educate themselves with these diseases. That's what I believe in. The more knowledge you will have, the more you will know about it. So knowledge is always better, I would say that. And having said that, friends, now I want to know what is going on building the wall at the border, because and our immigration authorities looking who is coming and who is coming to America. And I would request the immigration authorities to look into this matter, and very stringent procedures should be implied, so that infected people with hepatitis should not come to our border. Having said that, friends, now I will end this forecast, broadcast by saying that these are my two books, and through the sale of these books, I I finance these programs and I help underprivileged people by giving little bit to charity, and also producing these kind of programs. And please go and read these two books and give me an honest review. Having said that, friends, I would again request all Hollywood, Bollywood, Netflix, whoever makes movies, please contact me at Afshan at drafshanhashmi.com, because I want a movie to be made on this book, because it is high time that we should educate everyone on bioterrorism. And seeing a movie is a very very interesting way to study. I believe in education through entertainment. So if somebody could help me to make this movie and buy the licensing rights, it would be great. And people will be educated about bioterrorism in a fashion in which they can understand what bioterrorism is without stressing them. Have because these kind of news, when they come, like about bioterrorism, about an outbreak of a disease, people are very stressed out because life in America is very, very hard. Everybody works hard. Some people work 3 4 jobs. So this is the story of middle class America, and I belong to middle class America. So we all are very stressed out working to make ends meet. So having said that, if somebody, a producer from Hollywood, could step up and make this movie to educate people, I will be highly obliged to them. And whoever makes from Hollywood or Bollywood or whoever wants to educate people, I am open to everyone, and I am writing the screenplay, and that screenplay I would share with whoever contacts me regarding this book. The screenplay is going to be ready soon. I am writing that, and I want, I am open to the screenplay. Like, however, the producer of the film wants to modify it, I'm open to that, because I want a movie to be made on this book to educate people what these viruses and bacteria can do. And now, from now onwards, I will write books on this topic only, because it's high time, people like us who have been trained as scientists and who have are not hired as faculty positions, or I don't have a job, although I tried to be hired as a faculty position, but I am very, very smart in writing books. So I am going to dedicate my life for educating people on bioterrorism. I love America a lot, and I want America to flourish, and I want a disease free America. Having said that, friends, now I will sign off from this episode. Cheers and bye bye. And also, friends, please give me sponsorship so that I can, and this program will be syndicated worldwide to 300 million listeners. It will be on Amazon Musics, it will be on 100 platforms, and you can go to my website www.afshanhashmi.com and see where this program is syndicated. And having said that, friends, I have a whole list, and soon it will be going on Apple Plus and Hulu. So just and it is syndicated worldwide to 300 million listeners. I have 2 radio and TV shows from Talk 4 Media, and they are syndicated worldwide to 300 million listeners. And this one is StreamYard one live on goes on my doco series to 300 million listeners. So I want to educate people, and that is the mission of my life, and I am open to doing job also. So if somebody has a faculty position for me, or an expert on bioterrorism or these viruses and all, through my scientific knowledge and through my regulatory affairs relating to FDA regulations, I would love to contribute to that. Having said that, friends, looking for some sponsors to contact me at Afshan at drafshanhashmi.com, and just imagine your product will be promoted to 300 million listeners. Cheers and bye bye.